Hello, everybody. Welcome to the very first episode of the Doc Talk podcast. We are so excited to be here with you today. I am Dr. Shazma Mathani. I'm an emergency room physician in Edmonton, Alberta. I've been practicing for about 15 years in both pediatric and adult emergency medicine.
And I'm Dr. Sheila Wijayasinghe. I'm a family doctor in Toronto. I've been practicing for close to 20 years, and my focus is on general care and women's health and sexual health. You know, Shazma and I decided to do this podcast because we met online and we became admirers of each other's work. And then we decided to meet in person when I was visiting home, because I'm originally from Edmonton. And we thought, you know, it's really hard to navigate the healthcare system as patients. And we've been patients ourselves. We know what it's like. We've seen our patients struggle. And we wanted to be a source of reliable evidence-based information to get you through those journeys of navigating the system with ease.
And I think one of the things that really stuck out to both of us was just how much confusion there is in the information that's out there. Lots of kind of jargon, lots of, sometimes misleading information. And so for us, Sheila and I really wanted to break down health information in a way that's easy to understand, quick, with some takeaways at the end of each episode, so that you can go away from every episode with more information and be empowered with that. We're always looking for more topic suggestions, so please follow us on our socials at the Doc Talk podcast. You can DM us with topic suggestions and learn more about each episode there as well. So that brings us to our topic today. We are right into the fall. And so today, Sheila and I decided that it was really important to talk about the respiratory virus season, because it is here. It is going to be affecting all of you, your families. And we thought it was really important to be able to break that down for you all. So today we're talking about respiratory viruses.
I mean, I don't know about you, Shaz, but my family's already been through several respiratory viruses, it seems, and it's only October.
Exactly. Yeah, it's October. It'll be November when you're listening to this, so it'll probably be even a little bit worse than that. But yes, we've already had respiratory viruses run through the household. I actually had COVID a month ago already, and definitely starting to see that in the emergency department. So Sheila, why don't you tell me what you're seeing in your family doctor's office right now and what you kind of expect to see over the course of the season?
Yeah, so, you know, in Canada, usually cold and flu season extends from fall up until spring. But according to Flu Watch reports this year already, we started earlier this year at the end of August. So that's probably why we've both been experiencing these symptoms in our own personal lives, as well as in our work lives. So in the office, what we're seeing quite a bit of, we're seeing the typical cold and flu symptoms that people are coming in with in terms of upper respiratory tract infections. So commonly things like fever, runny nose, cough, sometimes with some difficulty breathing, depending on what that is. I've seen actually quite a bit of pneumonia as well, that we've documented on chest x-rays for some of my older patients and a couple of my younger patients as well. So we certainly are in it already. I'm not sure what you're seeing. What are you seeing in the emerge?
Yeah, so I mean, that's exactly like you said. I definitely noticed in the ER, both in pediatric and adults, that we were already seeing respiratory viruses come in through August, which feels early to me this year for sure. A lot of it in August was COVID, like kind of end of August into early September, definitely was COVID. And then as school started, I'm sure you saw this as well, I was starting to see a lot more people come in with respiratory viruses. And so when I see people in the emergency department, typically what I'm seeing is people coming in with either a prolonged fever, where parents are concerned about that, or respiratory concerns, where either an adult or parents are concerned about that. So whether that's wheezing, a barky cough, difficulty breathing, that's definitely the most common presentation that I see in the emergency department setting, and certainly what I've been seeing over the last several weeks.
Yeah. And so when people come through in family medicine offices, we're not doing testing for the different viruses that we're seeing. But I know that in emerge settings and inpatient hospital settings, that's where you're actually doing swabs on people. So can you tell us a little bit about what kind of viruses you're seeing in the emerge setting?
Yeah, that's a great point. So, I mean, in the community, we're really not swabbing anymore.
No.
But like you said, Sheila, in the ER, we are still swabbing patients who are coming in. And so definitely seeing a lot of COVID, starting to see some RSV. And I haven't actually seen influenza yet, but we're kind of just approaching that season. And I expect to start seeing a spike fairly soon. And so those are definitely the three main viruses that we are seeing, that we swab for, that we're going to kind of get into more details about today. And so what about you? Like, do you ever have patients where they end up getting admitted to hospital and being swabbed, that you're seeing kind of any patterns at all right now?
Yeah, I agree with you. It's the same. I haven't seen a lot of influenza. It's mostly COVID that we saw at the end of summer. Like you said, we are swabbing people in the office for COVID, but we're using the test kits that people can use at home. But the challenge has been is that people have expired kits, and they're older. So we did get a new slew of test kits in, and I think they are available now again, where there was a kind of a moment in time for several months that nobody could access these kits, but now they're coming back again. So I think that's always really important that if you have access to these kits, check yourself out at home. But we also are doing it in the office. That is the one swab that I do in the office. And I've seen quite a bit of COVID, surprisingly, because I think a lot of people are like, oh, we thought COVID was done. And actually, that's what we're seeing still.
Yeah, and I want to hear more about kind of symptoms that you're noticing with COVID. But one thing I wanted to make sure to mention is like these are the viruses that we test for, right? But there's like dozens of other viruses like rhinoviruses, enteroviruses, all these other viruses that we don't test for that also cause a lot of respiratory kind of symptoms that we're seeing as well. Just to kind of remind people that we don't test for everything. Yeah. And there are dozens of viruses that do cause it. So what are you seeing in the office in terms of symptoms for COVID-19 right now?
So it's similar things that it's really variable. Actually, I was surprised that people are having the typical symptoms of the runny nose, the fever, the cough, myalgia, so like muscle pain and sometimes weakness and fatigue. Fatigue is a big symptom that I see in the office. And then I'm also seeing some GI symptoms associated to COVID that people, and GI meaning gastrointestinal symptoms such as like stomach upset and diarrhea. And that was a newer symptom that has come. And so, you know, we often will say similarly, like enterovirus isn't one that we're testing for, but it could be COVID as well. So we're not at the same level that we were before, certainly, I think, during the pandemic, but it's still around. What are you seeing for COVID symptoms and they emerge?
Yeah, so I'm seeing definitely a lot of respiratory symptoms, but the main reason that people are coming in that end up testing positive for COVID in the ER is that they're having like lots of fatigue and myalgias and then prolonged fevers that they're not sure why their fevers are lasting so long. And typically when I see either an adult or a pediatric patient that has, you know, may not be getting admitted to hospital, but is having symptoms for longer than I would expect, that's one of the things that triggers me to swab so that I have a sense of what the cause may be.
That's so important. I'm glad that they're seeking care. We're going to get to like when do you need to seek care? Because I think sometimes it's confusing to know when you can ride it out at home versus coming in. So we'll definitely going to address that as well for families with young kids, but also for all of us as adults. So let's go in. Let's do a little bit of a deep dive into the specific viruses that we are seeing. We mentioned a few of them before, like influenza and RSV. You know, for influenza, what we see typically right now is primarily the H1N1 subtype. We see that prediction from the southern hemisphere, and we're seeing it come into the northern hemisphere where we are. And that is typically responsible for about 75% of flu outbreaks that they've seen. And we haven't necessarily seen that yet, but it seems like that is what we're going to be seeing coming up in the coming months. What do you see for influenza A for symptoms?
Yeah. And I mean, I think that's a good point. Like for H1N1, as the subtype of flu A that we're seeing, like that is typically the most severe subtype as well in terms of the severity of symptoms. More people are tending to get admitted to hospital with symptoms for that. And the two populations that I see, and I'm sure that you notice as well in your clinic, is that younger patients, like kind of infants under the age of 1, under the age of like kind of 1 or 2, and then the older elderly patients or anyone with comorbidities. Those are people that are going to have much more severe outcomes. And then of course, pregnant patients too are at much higher risk of having severe disease. And so similarly, like I typically see those respiratory symptoms, right? So cough, fever, sore throat, runny nose, stuffy nose, and then like the more kind of generalized body symptoms. So the like fatigue, body aches, headaches, that sort of things. But one thing that I have noticed a lot last season, and then that we typically can see with influenza as well, similar to COVID, is those GI symptoms, especially in younger patients. I've noticed that they do often present with like the, you know, vomiting, diarrhea, abdominal pain as well. I think one important thing that is important to mention is complications of influenza. That's something that, you know, I often see and emerge, but you probably often will send your patients to the ER for as well. So what kind of complications can we see with influenza?
Yeah, so what I've seen in the past, I haven't seen influenza specifically yet, more COVID, but when my patients have been hospitalized, it's for pneumonia related to influenza. So that's the sort of the bigger one. And you mentioned comorbidities before. And when we say comorbidities, we mean things like if you have a history of other medical conditions that can put you at higher risk. And specifically, we look at things like asthma, COPD or emphysema, it's also known as. Diabetes can also put you at higher risk. And Shazma, you mentioned pregnant folks as well, because the immune system can be a little bit compromised, similar to our elderly patients. So pneumonia is a big one. And some people get like flare-ups of their asthma or COPD as well. And that sometimes will require hospitalization as well. I've had a couple of patients hospitalized recently for exacerbations or severe like worsening of their pre-existing emphysema.
And I think that's where like vaccination becomes so important, where we're going to kind of come back and talk about that. But if it's okay, I do want to tell a story about my son who actually ended up getting hospitalized with influenza A last year.
Tell us.
Yeah. I mean, it's something that's on, like, it has been hard for me to talk about. It's a year later now. And so the reason that I want to tell the story is just because it kind of really drives home how severe influenza can be. So we all got vaccinated for influenza last year, but we were a bit late because the household was sick. And so we were kind of waiting for everybody to get better before we all got our flu shots. And so my family had only been vaccinated about a week before. And so that exposure probably happened pretty quickly after we got vaccinated. My son woke up kind of at 9 p.m. with a terrible barky cough and like stridor. So really noisy, restricted breathing, where he was having extreme difficulty breathing. I was actually driving home, and my husband called me in a panic, and I could hear him in the background, and I could hear how distressed he was, like my son. And so I'm like, just hang up the phone with me and call 911. And kind of by the time I pulled around the corner, the ambulance had just pulled up. I went inside, saw like how sick my son was and how much difficulty he was having breathing, and kind of just scooped him up and ran outside to the ambulance. And so with influenza, what ended up happening is that he had upper airway kind of inflammation leading to croup, where he was having a severe barky cough. His airway was so inflamed that he was having difficulty breathing, and his oxygen saturation was actually very low by the time they hooked him up in the ambulance. And like, you and I know that when ambulances go lights and sirens, it means like, normally ambulances actually don't drive lights and sirens. I think that we often see that, but typically ambulances don't drive lights and sirens. We zipped over to our pediatric hospital extremely quickly. And we ended up having to stay overnight. He had both croup and a pneumonia on his chest x-ray from the influenza A, which developed all extremely quickly. And thankfully he's okay. There have been like no lasting complications from it, but it's true. And he was 5 at the time. No underlying medical conditions, no underlying lung conditions, completely healthy, has all of his routine vaccinations, picked it up somewhere in the community, and ended up in the ER in a very serious situation. And so I just wanted to share that story to drive home the point of like how important it is to prevent getting influenza A, even if you're a completely healthy individual, because it can be very serious, especially in those extremes of age.
Wow. I can see, like, even when you're talking about it, how it affects you still, because it's very scary when those things happen. Like, as a parent and as a clinician, when you know and you know that when the lights go off, it's very serious and it's scary to be in that. So I think that's so helpful that you're sharing it, that we're all vulnerable to this. And this is why we wanted to talk about it first, because we've had firsthand experience. My kids are recurrent groupers as well. And we've had to go lights on to the emergency room with the ambulance several times when they were younger. And it's a really scary thing. And so like scary. When parents, and you know your kids, like when I emphasize this to my parents in our practice, like, you know what your kid's baseline is, you know, when they're sick, kids get sick really quickly. And this isn't meant to scare anybody. It's just having that awareness if that's what we're here for. I would much rather see a family come in and say, we weren't sure if we should get checked out or not, but he sounds different than usual. I'd much rather see you in our office than you waiting it out and having an episode like that in the middle of the night. Like, we can support you earlier on. So, and sometimes we can't predict when it's going to happen, like those middle of the night moments with croup, when croup seems to hit the worst.
It really does.
It does.
Often
it's always in the middle of the night. And
your
kid looks totally fine right before too. So it's hard to sometimes predict. But that's when you have like us available as your healthcare providers to like get help soon.
Exactly.
RSV is actually, my kids had croup with RSV specifically. So you must see a lot of RSV in the emergency room. So can you tell us a little bit about RSV?
Yeah. So RSV is another respiratory virus, a virus that really disproportionately affects younger patients more severely, I'll say, and then older patients as well in different ways. And so typically what I see in the pediatric ER is young infants, so under the age of 1, that come in with quite severe breathing issues. And the reason for that is because their airways are just so much smaller. So any sort of inflammation that happens from this particular virus affects those small airways more severely. They start having wheezing and difficulty breathing and low oxygen, and lots of kind of congestion in that upper airway as well. So it affects both the upper and the lower airways. And these babies can be quite sick and require admission to hospital. And so this is typically what I see in that young age. And then on the flip side, it can severely affect older individuals as well, and more likely to cause a pneumonia with these patients. And so these kind of more elderly patients or older patients with comorbidities can have significant complications from RSV as well, leading to admission for more pneumonia type symptoms.
Right. I mean, the good news with RSV is that we now have options available for prevention in terms of vaccination. And so this has been rolling out. It rolled out in Ontario recently. I know it's rolling out. It might have already rolled out in Alberta. And across the country, RSV is now available as a vaccine for kids and also for adults, for the elderly population. That rolled out last year. And this year we have something different for kids.
Yeah, and it's so great to be able to see that because of all the comorbidities and kind of complications that we see every day from RSV, for sure.
So it reduces hospitalization and more complications. That's wonderful. Now, we talked a little bit about COVID-19, which is still around. We kind of went through the symptoms around it. One of the things I wanted to touch upon with it wasn't just the infection itself, but what I'm seeing a lot in my practice is after people have had COVID is long COVID. And so and actually it's really hitting women between the ages of 40 to 60. And that seems to be the highest risk group. We don't quite understand why that is, but it is interesting to see it, which again, if you have COVID, we can't change that, but we want to be able to prevent it to reduce the risk of long COVID in the long run.
Yeah. What kind of symptoms are you seeing with that?
Fatigue, loss of sensation, so like loss of taste or smell seems to be persistent for some of these folks, muscle pain, but fatigue is a hallmark feature for them.
Yeah. Yeah.
I mean,
I certainly noticed, and I've certainly noticed like the couple of times that I've had COVID, I've noticed that like just takes a bit longer to recover, right? Compared to just the run of the mill kind of respiratory viruses. So I think that's an important point to mention as well.
Absolutely.
Yeah, I do want to shift gears because I know like for me, I'm interested to hear what you say about this, but so many parents when they come into the emergency department are like, my kid just started daycare and they're sick all the time. And
all the time.
I mean, I certainly remember when my kids started daycare that they were, in fact, it felt like they were sick all the time. And so why do we see that? The parents always ask me, like, why does my kid get sick so much when they go to daycare? So why do we see that, Sheila?
Yeah, it's very, very common. Same thing happened with my two kids. They're 5 and 7 now, so we're out of that age group of daycare. But daycare, I feel like in all kids, and I don't know if this is okay to say this, but like kids can be kind of like they're germ buckets and they're full of germs and they spread them everywhere. And this is sort of, in daycare especially, we know really commonly, I always give my parents in my practice a heads up. As their kids are starting daycare, I said, you're going to see a surge in infections when your kid goes to daycare. And on average, and this is a big number, toddlers and kids in daycare may develop about 8 to 12 colds or infections in their first year in a group childcare setting.
Like that's one a month.
That's one a month.
Yeah.
Yeah. And so a lot of parents will come in and say, can you check my child's immune function because they're getting so sick so frequently? And it's actually that their body is responding to exposure to all these different viruses. And again, they're beyond the viruses that we shared earlier. It really is that daycares are this ideal breeding ground for viruses, and kids are close together. I've peeked into daycare because I was one of those moms that would drop their kids off and like peek over the gate to see what was going on.
And you see how gross your kids are.
They're so gross. And they're like putting things in their mouth, and then the other kid comes over and takes it from them, and then they put it in their mouth, and their fingers are everywhere. And it's just like a lot. And it's a way that they're socializing, and it's so beautiful that they're socializing and they're kind of sharing, but kind of grabbing. But they get so quickly sick that even with like diligent cleaning, and I know daycare teams are really working on this because the staff there also is exposed, but it's very difficult to prevent the spread of germs easily. There's some good news to that though, Shaz. Like, Yeah.
I mean, one thing that I often tell parents, because they will say like, oh, my kid has been sick for this many weeks, like straight. And I think the one thing to always keep in mind is that the symptoms can linger. And in particular, the cough, it's common to see a post-viral cough that can last up to like 4 to 5 weeks after the illness has resolved. But then the problem with that is that when there is a new virus, it resets the clock. So it certainly feels like the child is always sick. And this is education that I give the parents that I see all the time in the ER. It's like, yeah, it might seem that they're always sick, but that cough is going to linger. It's typically worse at nighttime and in the early morning. And then as soon as there is a new virus that comes, those acute symptoms kind of spike up again. And then it really just has the appearance that they're always sick all the time, which is really challenging to manage as a parent.
It is. I mean, we're always juggling like childcare, figuring this out. My parents recently moved to us, but also when my kids are sick, I don't want my parents who are elderly to be exposed. And so, we're having to take time off. It's a lot. I am often writing letters for parents to take them off work while their kids are sick, just to give them that accommodation to work from home or figure things out. And we're happy to do that, because when you have small kids, this is part of the reality of managing that, especially the first year of daycare. The good news is that, while kids in daycare tend to encounter more illnesses and they get sick more frequently, what's also been found is that it helps them kind of build a stronger immune response. So those kids who go to daycare in those early years will, when they hit elementary school, tend to be less sick than their peers are who did not attend daycare, because they've already sort of been exposed to these common viruses. So
exactly,
there's a light at the end of the tunnel, where I saw that as well. So, and I could see it in sequence with my 7-year-old, and then my 5-year-old, when he came through, he got everything she got. So he actually gets sick a little bit less. It's interesting to see that, but that's a bit, not while you're in it. It's not really helpful while you're in it, but it's helpful to look ahead.
Exactly. And I noticed the same thing with my 8-year-old and 5-year-old as well. When my 8-year-old went through, she was getting sick a lot more, but then my son was getting those as well. And then it felt like it was less. It felt like he was getting sick less often when he was going through that same first year of daycare. So let's talk about how we can prevent this or mitigate this. So what are some things that parents can do to help decrease the amount of daycare viruses or even school viruses and germs that are coming home into the household? Because once the kid gets sick, the chances of the parents getting sicker are quite high as well.
Yeah, for sure. So, we always, the same things that apply to adults as well. So things like good hand hygiene, encourage hand washing, teach your kids early how to wash their hands using soap and water. You can use a hand sanitizer as well. It's considered safe in kids, but you just want to make sure you're dispensing it. My kids will pour the whole bottle on their hands sometimes. And I'm like, oh, that's not great. But soap and water is great, though. Staying up to date with your vaccinations, if it's flu season, if you're young enough, RSV, and also getting the COVID vaccine if you can, and then rest and nutrition is really helpful. One thing I just want to touch upon briefly is that there's a really interesting study done in the UK that was done with saline, and parents are always wondering, what can I do to decrease the intensity and length of these illnesses? And this was a fascinating study that was done in the UK, where they had over 400 kids under the age of 6 years of age and who were sick, and they gave half of the group saline drops, the things that you buy over the counter, just saline water. And they asked the parents to instill that into with a spray 4 times a day for the kids, for half of the kids, and the other half of the kids just did their usual cold and flu symptomatic relief treatment. That was it. And then it was interesting because the kids who got the saline nasal spray had a shorter duration of symptoms. So they had, instead of having 8 days of symptoms, they had 6 days of symptoms. And that was significant.
But not just that, there's another awesome thing in that study too.
It was so good. You go. It was exciting.
Yeah, it was exciting. And I was like, oh, maybe I need to have saline drops on hand now. So
definitely.
Important to know that it's a small study, but the risk here is pretty much negligible, right?
Yes.
And so for me, it's why not just try it? So in addition to having a shorter duration of symptoms, it actually reported that fewer family members of the children got sick as well, which for me as a parent is huge. I'm like, you know what? Saline drops, there's no real harm.
Just make sure they're saline. Exactly. Or if you are buying the ones that you mix up to make saline, you want to make sure that you're using sterile water, because you don't want to just use tap water. You want to sterilize it first. But there's no harm in doing this, and it's cheap and it's easy to do. It's not easy to do. I should preface that. Getting saline nasal spray into your kids' noses is not always easy. But I get my kids to kind of do it themselves, and I help them with the spray bottles, and they kind of like it. And you can get the misting ones, and that's also a helpful option. But I was really excited to see this study because it was a low cost, low barrier option that could reduce the duration of symptoms, and most often just to help families not get sick as well. So that's really helpful. And then also Shaz, tell us about ventilation.
Yeah, so ventilation. Ventilation is basically how much air is moving through a space. And there is really good data from the CDC that shows that having a well-ventilated space actually decreases virus transmission. And it makes sense, right? Because as there's more air moving through, there's a lower viral concentration in the air, and then you have less chance of transmitting those viruses between people. And so one of the best ways to kind of assess how well a room is ventilated is by measuring the carbon dioxide, because that's what we breathe out. And so as that air is exchanged, we know that if that carbon dioxide level is lower, it means the air is being exchanged more readily. And so I want to take a brief moment to really thank our sponsor for today's episode. So our sponsor for this episode is AirValent, and they sent both of us these really cool little CO2 monitors. So I'm just going to hold it up to the video here. So you can see that I have a thumbs up on mine that shows that the CO2 level in the office where I'm in right now is good, which means the air is moving well. And they also wanted to extend an offer to all of our listeners to get your hands on these awesome little CO2 monitors that I've been using quite a bit throughout the summer and into the fall. Helpful. Yeah. And so any listener for this podcast, if you go to AirValent and use the code TheDocTalk at checkout, it gives you a discount to get one of these monitors. And, you know, when I had COVID, I isolated from my family. I had this in my room, and I could see immediately, like as I was in the room, as the CO2 kind of approached a bit of a higher number, you open the windows or increase the HRV in our house, and it dropped quite readily. And I actually did not spread COVID to the rest of my family at all. So it really just anecdotally, you know, N of 1 shows that like the importance of ventilation to kind of keep viruses from being transmitted even within a household is quite valuable. And it's nice to be able to see a visual number to kind of to react to and to help kind of mitigate that ventilation if it's poor, to have something to act on.
That's amazing. It's really helpful. It feels like you can do something about it in that moment too, right? It gives you information. So tell me a little bit, Shaz, a lot of questions come up around how can I prevent cold and flu season with supplements? And you did a great post on this recently. So can you share with us, because people buy a lot of supplements and they pay a lot of money, and there isn't a lot of evidence for some of the things that we commonly take.
Yeah. And so for most of the things, there is actually evidence against it. There's been robust enough data to show things like vitamin C and echinacea and Cold FX, which has a lot of echinacea in it, is the main ingredient, don't actually prevent colds and don't actually reduce the duration of colds. There is one. So there was some kind of mixed data on zinc and elderberry, where the jury is still out. I won't say, like, the data for me doesn't show strongly enough that it does reduce colds, but it can, like, there is some mixed data that shows that it may reduce the duration of cold symptoms, and it may also prevent you getting colds. And so, I mean, for me, like, that, it's not enough data for me to say, like, yes, I'm going to take this every day, but it's interesting. Like, as more studies are done and as more data comes in, it would be really great to be able to see that there may be some sort of a supplement that we could take to help decrease the amount of colds that our family is getting during the respiratory season, for sure.
And what about vitamin C? Because I find people, and ourselves included, sometimes like load up on vitamin C right before when we get a cold. But I believe it's only effective if you're taking vitamin C every day. Every day and in like fairly high amounts. And so again, like, that's not one that actually that for me makes sense to take, because it the evidence certainly wasn't strong enough. But there are a couple of what I'll call natural remedies, or so like non-prescription or non-kind of pharmaceutical remedies, one of which you already talked about, which was the nasal saline. But the other one that I often recommend to patients of all ages, as long as you're over the age of 1, is honey. Do you ever recommend that to your patients? Yeah. So for kids under the age of 6 who we recommend against using cough syrups, I often will use honey just to soothe the cough. But tell me about what it means in terms of cold and flu prevention. That's exactly it. And so what I typically recommend, so of course it's important to note again that like anyone under the age of 1 should not have honey because of the risk of botulism, but anyone, even in adults, there's actually decent data to show that honey works as a very good cough suppressant. And so in patients that come in and see me that have these lingering post-viral coughs at nighttime, I recommend that either in the older patients in the household or in the younger kids, either before nap time or before bedtime, having a teaspoon of liquid honey can actually be quite effective at mitigating those cough symptoms in particular. Yeah. I want to, before we close up, I want to actually just really briefly touch upon when to seek care. I think it's really important. I think people will suffer at home sometimes through symptoms, but I want to emphasize again, if you are struggling to breathe, if you have a prolonged fever, now fevers can last. Fever is a normal reaction in your body to what the the virus or bacteria that you have. So it's normal. But if it's prolonged or causing any other symptoms, with kids especially, we see worry around dehydration, lethargy. Those are the symptoms to seek care for. You don't have to wait it out. Make sure that you're seeking care coming into your family doctor's office. If you don't have a family doctor, a walk-in clinic, or in severe situations, the emergency room. Breathing is such a key piece to this. Like I'm having kids who croup. Shazma, you've seen that.
Yes.
You want people to come in earlier than later in those situations.
And one thing that I always say, especially when patients come into the emergency department to see me because they're worried the symptoms are severe, like I am never upset about somebody coming into the ER when it comes to breathing. If it ends up being all fine, great. It's fine. And I get to send you home with some, education and management tips at home. But like, if there's any point where you're worried, or even as a parent, I always say if something doesn't feel right? You kind of mentioned that when I was telling the story about my son, Sheila, that if something doesn't feel right, parents know. And if it doesn't, seek medical attention, because there's, your child the best. And if there's something that, gets your spidey senses up, you need to seek care as far 100%. As I'm concerned.
I trust the parents in my practice implicitly because they know their kids at their baseline. So this is super important. So what I'd love to do is end with what our Doc Talk prescription is for this week. So respiratory virus season is upon us, and our prescription for you today is all of the following things to make sure that you're staying safe during the respiratory virus season. So as Sheila mentioned, really good hand hygiene. So the rule in my house is as soon as we walk in the door, it's washing our hands right away. That is such an easy thing to prevent transmission of viruses into the house and within the household as well. We talked about improving ventilation and then adding in something like air purifiers as well that can kind of filter the viruses out of the air. Another important thing to consider is masking in crowded spaces, or if you have to go out or be around people and you're sick, putting on a mask to protect those people around you. Staying up to date with your vaccinations. So COVID-19, RSV, influenza, please get your family vaccinated for those. And then, of course, most importantly, please stay home when you're sick, because you need rest. Your body needs rest to kind of recover from that virus. But at the same time, we don't want that virus going out into the world to being spread kind of among everybody else. Anything to add there, Sheila? Yeah, the only thing I would add is you don't have to be miserable through the symptoms. You can take some symptom relief just to kind of get through. So things like acetaminophen or ibuprofen can be helpful if it's okay with your other medications. That can be really helpful for the pains and the aches that you might experience. The honey, as you mentioned, Shaz, and the nasal saline sprays are also really helpful for kids and adults alike. So, all of these things together can help get you through the season. It is unfortunately inevitable that we live in a space that we will be exposed to these things, but there are things that we can all do to reduce transmission and risk to ourselves and our loved ones. So we're thrilled to be with you today. Shaz, do you want to take us out?
Yeah, so that's a wrap for our very first episode of the Doc Talk. Thank you so much for being with us today. We can't wait to share ongoing health information with you. Please check us out. Follow us on Instagram, TikTok, X, at the Doc Talk Pod. You can send us DMs there to make some topic suggestions. And yeah, we can't wait to go on this healthcare journey with you. Thanks for tuning in today.
Thanks, everyone. See you next time. The Doc Talk is for general information purposes only. This podcast is not intended to replace medical advice from your own doctor. While we are doctors, we are not your doctor. Always speak to your own healthcare provider for any questions related to your healthcare needs.